Traumeric. This is kind of a play on words. It's a mixture of trauma and then also turmeric. I don't know how many people come into the office and they're on some type of anti-inflammatory drug or a non-steroidal anti-inflammatory. That would include ibuprofen, naproxen, Naproxen, Advil. All these over-the-counter medications other than acetaminophen, Tylenol are considered in the class of anti-inflammatories. And while they can be pretty potent painkillers, they have a lot of issues. Thousands of people die from these drugs every single year. We don't really hear about that very often. The reason they die from it is because it's really hard on your stomach. It can cause ulcers, which then leads to bleeding, and then people who might be anemic or who don't catch the blood early enough end up dying of these bleeds. It also causes decreased blood flow to your kidneys, which can cause kidney failure, especially if you happen to get dehydrated while you're taking them or if you have some kind of underlying kidney disease. And then we also think they're associated with heart attacks and heart failure. So they're not really great. And then another thing that really bothers me is they kind of defeat the purpose you're taking them, and that most people take them for musculoskeletal pain, and over time it causes that musculoskeletal pain to get worse because it doesn't allow your body to heal properly. You're probably thinking, I've never heard any of this before, right? Yeah, unless you've come here. The body's inflammatory response is the way that our body heals itself. Now, some people do have uncontrolled inflammation for other reasons, maybe unhealthy reasons. But if you go and twist your ankle or you fall and hit your knee, when it swells up like that, that's the body's way of trying to take care of itself. The healing process gets started when you hurt yourself like that. And so if you start loading up on anti-inflammatory drugs, which just about every doctor prescribes those when people come in after an injury, what you're doing is you're blunting your body's healing response. Now, the nice thing about this supplement is that it kind of modulates the inflammation. So instead of totally cutting it off, it modulates it. So it allows those healing molecules and the healing properties of the inflammation to still continue, but still takes off the edge of the pain some. The normal dose of this is 1 twice a day, and this would be taking the place of someone who's taking, let's say, ibuprofen every day for pain, the knee pain or back pain, things like that. This would be a very safe alternative, and it's something that's not going to keep your body from healing. Well, I hope you enjoyed that little video about some information on that supplement. I hope you found it interesting and helps you make a decision. If you have any more questions, please feel free to give our office a call. We'd be glad to answer as many questions as we can. Probably the best way to do it, though, is to schedule a consultation. I'd be glad to go over your supplement regimen with you. We also have many ways to check your vitamin levels to make sure you're not wasting money on supplements that you don't need, and to make sure that the ones that you're taking are of a quality that will be absorbed and utilized in your body correctly. Once again, this is Dr. Scott Nall from the Village Osteopath, helping you restore your health and optimize your life.